Most of the regimens that we use to treat advanced lung cancer are every 3-week regimens. For instance, for non-squamous patients, the 2 typical combinations we use are either carboplatin with paclitaxel or carboplatin with pemetrexed, plus or minus bevacizumab. Those are drugs that are given once every 3 weeks. Does not necessarily require a clinic visit in between the 3 weeks. So they have a level of convenience that's actually quite nice. When you're in the clinic, depending upon the efficiency of the clinic, these regimens would typically take 5 to 6 hours to administer. From the time you get there, have your blood checked, the doctor or healthcare professional have to check you out, make sure it's okay to go with chemotherapy. You have to have your labs checked. Someone has to order the chemotherapy, it just doesn't appear. The pharmacist has to mix it up, the nurse has to administer the drug. So, by the time all that's done with these sorts of regimens, we're talking typically about 5 or 6 hours.
We've now decided on treatment. Let's, for example, say it's going to be carboplatin, paclitaxel, and Avastin. So what happens now? Well, we make sure we have your labs, which means your chemistries from your blood and your white blood cell count and your red cell count. So we will draw blood to make sure that we know what those levels are. We will then administer the drugs. You get those via an intravenous method. So usually you either put in a line, which my nurse will talk about to you, or an IV. And usually you spend a few hours in infusion taking these drugs. They're given once every 3 weeks, so we'll repeat this process again in 3 weeks with blood work, and then as long as the blood work looks good, we'll continue with the therapy. And after we finish 2 cycles, that is 2 3-week segments, we will repeat CT scans or imaging. And that's when we take our first assessment to see if the tumor is shrinking, growing, or the same. 2 of those answers we like. We like one of those answers better than the other, but we still accept 2 of those answers. The third one, the growing, we don't like so much, but it still can occur in some patients. We will then, as long as the tumor is the same size or shrinking, do the exact same thing again. We would then move to cycle 3 and cycle 4 and repeat the imaging. If everything looks good after 4 cycles, so that's 4 times 3, that's 12 weeks, we then assess, is it appropriate to now go on to maintenance, which is just the single drug Avastin, or if the tumor continues to shrink and you're tolerating it really well, the patient is, then should we give cycle 5 and cycle 6 of the 3 drugs? And that's a decision point that's made after 4 cycles. My nurse will be here. A nurse should be helping you, can answer questions. We usually have a pharmacist and an ACP, which is an advanced care provider, a nurse practitioner, or a PA. We also have navigators or social workers that can help. So there's a huge team involved when delivering your care. And that's just in the clinic. When you go to the infusion room, there's also a nurse infusion specialist who's able to help you there, a pharmacist who's mixing the drugs. So it's a very large team. It can, again, be a little confusing on who to ask what question, and I would encourage you not to ask every question to every person who comes to you, but to be specific in where to direct those questions. Anyone will help you, but our team here in the clinic is the quarterback. So that's where a lot of these questions are relevant and can be directed to any one of our team members here in the clinic as we make those decisions on how we're proceeding forward with treatment and what drugs.